Welcome back. So, we are about to begin the fifth plenary session of this 21st annual Pakistan Endocrine Society conference. This session basically is based on calcium metabolism and parathyroid related disorders and disorder associated with the bone metabolism. We are honored that we will be joined by the stage on the stage by three renowned endocrinologists of the country. To be honest, none of them need any detailed introduction. We know all of them. We have been aware this what they have served in this to this country in the field of endocrinology. They have received the Lifetime Achievement Award in the field of endocrinology. So before we go for the session and the talks, I will like to invite Professor Dr. Saeed Ahmed Saab to come and join us on the stage. He's the past president of Pakistan Endocrine Society, the past president of ACE Pakistan chapter, and he has received Lifetime Achievement Award for his services in endocrinology. Sir, please join us on the stage. He will be joined by Professor Abdul Basit Saab. He is the director of Bekai Institute of Diabetes and Endocrinology, Karachi, as a multiple achievement in the field of endocrinology. And the last but not the least, Professor Dr. Zaman Sheikh Saab, who is being associated with the Sir Syed Medical College, Karachi. He was here. Hopefully, he will be joined soon by will join soon the other panelists as well. So to move on, we have three talks for today. Two of them are virtual talks. The foreign speakers who are not available here, they will join us on the internet and we will be enlightened by their vision regarding their field of endocrinology and their given topic. For your patient listening. Now I would like to give the podium to the chairpersons if they want to comment and conclude the session. Over to you, sir.
Thank you very much, Dr. Faheem. These were three excellent topics and three excellent speakers. I want to comment on Professor Ali Jawa. Is he here?
Yeah.
His talk. There was a new era in future, maybe. We are talking about transplantation of pancreas in type 1, maybe type 2 diabetes. Why not transplantation of other endocrine glands? It's a new thought, relative new thought, like parathyroid. Why not thyroid? And why not pituitary, which is more complex? If we replace pituitary by transplant, we can solve so many endocrine problems. Endocrine adrenal gland is another complex endocrine gland. But if there is transplantation possible, why not permanent treatment of adhesions, which is lifelong? So I think it's a new era in future in which we can think of, and certainly research work they are thinking of. You mentioned about this. Is there any scientific study behind this, or these are initial thoughts? These are my comments and question as well.
These are actually well-established studies. They are not been accepted as the universal treatment because of the fact that everybody is not convinced that it should be done. But your thought is very well taken. This is none of them are experimental in the sense they have been properly ERP approved and published. But whether it becomes mainstream or not, let's see.
I think it's a very well presented, all three talks, especially the Professor Vivan, Dr. Ali, and Professor Pedra. They have done justice to the topics. So I think so. This is one of the best sessions. After the lunch, I think so. It's difficult to absorb, but they have done very well to their topics. Thank you.
Thank you so much. So before we conclude this session, I would like Professor Ali Jawa to come up the stage and receive his certificate from the chairs. chairs as well. Sir? And to me as well. So this concludes our fifth plenary session. It will be followed by the sixth plenary session that will be on adrenal diseases. In the side hall, there will be a poster presentation. So if you want to join that, so this will adrenal session will be in Naimul Haq session hall, and the poster session will be in Professor Abdul Jabbar session. Thank you so much.